Hey, welcome. Today we're diving into one of the most incredible corners of modern medicine, how surgeons literally rebuild the human body. And we're talking about a world where these doctors have to be more than just doctors. They're part engineer, part artist, and part puzzle solver all at once.
So just imagine this for a second. A surgeon successfully removes a dangerous tumor from a patient's face. Fantastic news, right? The cancer's gone. But the big challenge? It's left behind a hole, a defect that you can't just stitch closed. So what do you do? I mean, this is one of the most basic and most difficult problems in all of surgery.
Because we're not just talking about patching a hole here. We are talking about rebuilding a piece of someone's actual identity. The real goal is to restore not just how a person looks, but how they talk, how they eat, how they smile and express themselves. It's an unbelievably complex job that changes a person's life forever.
To handle that kind of complexity, surgeons have, for over a century, followed a core set of guiding principles. You can almost think of them as commandments for reconstruction. And that brings us to this guy, Sir Harold Gillies. He was a true pioneer of plastic surgery, and he came up with this foundational rule: replace like with like. Now, it sounds so simple, but just think about how deep that is. If you've lost skin, you need to replace it with skin. If you've lost bone, you gotta replace it with bone. The goal is to make the repair look and feel like it was always a part of you. And he didn't stop there. Gillies laid out these other core ideas. Always fix the main problem first, never ever throw away healthy tissue, and this is the big one for our story today. Always have a backup plan. He actually called it the lifeboat. Remember that word. So how do surgeons actually do this? How do they follow these rules? Well, one of the most ingenious techniques ever invented basically involves moving living tissue around on a leash. This amazing technique is called a pedicled flap. What a surgeon does is take a whole section of skin, fat, even muscle from a healthy part of the body, but, and here's the key, they leave it attached to its original artery and vein. That connection, called the pedicle, is its lifeline. It keeps the tissue alive while it's being moved into its new home. The analogy on the slide is just perfect. It's like moving a patch of grass, but you keep a strip of the original turf connected so the roots don't die. Let's look at a really elegant example. For a small hole near the mouth, a surgeon can use something called a nasolabial flap. They basically borrow a small piece of tissue from the cheek right next door. And here's the genius part. The scar from where they took the tissue gets hidden perfectly in the patient's natural smile line. It is so smart, so efficient, a perfect example of replace like with like. But what if you need to fill a much bigger hole? Say, after removing a large part of the jaw. Well, for that, surgeons have a real workhorse they turn to, the pectoralis major flap. This is a big deal. It involves taking a huge piece of skin and the main chest muscle, the pec, and then carefully tunneling it up through the neck to rebuild the whole area. So why is this flap such a go-to? Well, for one, it has its own super reliable blood supply, the thoracoacromial artery, which means it almost always survives the trip. But it's not perfect. It's a trade-off. That muscle can be really bulky, which isn't always great for delicate facial work, and it leaves a pretty significant scar on the chest where the tissue is taken from. And that right there brings us to a fundamental truth about surgery. Every single decision a surgeon makes is a compromise. It's a constant balancing act between solving one problem without creating a worse one somewhere else. And you can really see that balancing act right here. The advantages are huge. These flaps are reliable, they're simpler to perform than some other crazy techniques, but the disadvantages are just as real. The leash, that pedicle, means it can only reach so far. It can be bulky, and it causes something surgeons call donor site morbidity, which is a really important concept. Donor site morbidity sounds complicated, but it's pretty simple. It just means you can't borrow tissue from one part of the body without leaving a mark there. It's the price you pay at the donor site, a scar, maybe a change in the contour of the body, or even a loss of some function. And the true art of the surgeon is making that price as low as possible for the patient. Okay, so I'm gonna throw a number at you. 1 in 11,000. What in the world could that possibly have to do with this surgery? That's the odds of someone having Poland syndrome, which is a rare condition where you're just born without a pectoralis muscle on one side of your body. Think about that. It's just one of a million variables a surgeon has to consider. What happens when your go-to workhorse flap just isn't there to begin with? You've got to have a different plan ready to go. And this all brings us to the final and maybe the most important role these old school flaps play today. It brings us back to that idea of the essential lifeboat. See, for most of the 20th century, the techniques we've been talking about, these pedicled flaps, were it. They were the undisputed kings, the absolute gold standard for rebuilding the head and neck. But then, a revolution happened. It was called the microvascular free flap. Using this technique, surgeons could completely detach tissue from anywhere, your leg, your forearm, your back, and then, working under a super powerful microscope, they could literally replumb its tiny little artery and vein into new blood vessels in the neck. The precision is just mind-blowing. Which, of course, leads to the big question. With this incredible new technology that lets you rebuild things with more precision than ever before, are these old school pedicled flaps totally obsolete? Have they just been replaced? And the answer is a huge, resounding no. They didn't become obsolete at all. Instead, their role shifted. They became the exact thing Sir Harold Gillies predicted they would be nearly 100 years ago. They became the lifeboat. So what does being a lifeboat actually mean today? Well, if one of those complex, high-tech free flaps fails, what do you think the surgeon uses to save the patient and the reconstruction? The reliable old pedicled flap. They're also used for patients who are too sick to survive the marathon 12-hour surgery a free flap requires. And honestly, for some jobs, they're still just the best, most reliable tool in the box. And that really leaves us with this fascinating question, one that goes way beyond the operating room. When our newest, shiniest, most complex technology fails us, what do we fall back on? What do we trust to save the day? Well, the answer seems to be the robust, reliable, and brilliantly simple foundation that it was all built on in the first place. And that is the enduring, life-saving power of the lifeboat.